Hello everyone.
Hello everyone.
Today, actually, I'm having a special guest. As you know, that I'm Dr. Rasha. I'm a GP dentist in Infield Royal Clinic. I work mainly in cosmetic dentistry. And today I have a special guest from our dental lab. His name is Joshua. We are both dealing with the veneers, and we are trying to deliver the best cases of veneers. So I thought that it's a good idea to share with you few tips or few infos about the veneers. So Joshua is here to help me about it. Hi, how are you today?
Good. Yeah.
A little bit of introduction about yourself, and then we can start talking.
Definitely. Yeah, my name is Joshua. I'm a master dental technician from Germany. I'm here in Dubai already more than 7 years. Yeah. We have our dental laboratory located in JLT. I have there professional team of different dental technicians who are coming from different countries, from Austria, from Germany, actually from all over the world. And yeah, I'm here today to speak a bit about veneers and
Joshua will share his experience in veneers because you all know that the doctor is able to prepare the teeth for the veneers, but it's the work of the lab that matters because they are the one who will deliver for us these beautiful Emix veneers or any type of veneers that will show the beauty of it. Now, you know that veneers is becoming trending lately in the market, and it's so important lately for most people to look good, to feel confident about their smile. So the veneers is doing this. It's like giving us a great alignment of the teeth, a good shape, and also a good color, regardless the range of white that the patient will choose. So by the way, if you have any questions about the veneers, please just ask us in our live. Joshua will explain a bit what is veneers, and you can share with us a few infos about it so we can help our patients.
Yeah, so basically when we are speaking about veneers, a veneer is ceramic chip which we will place over your teeth. And yeah, as Dr. Rasha was mentioning, we have there different types of veneers what we can choose, or different shades, different colors. And yeah, we in the lab are producing them individually over each tooth where we want to place the veneer. We are getting then the impression which Dr. Rasha is taking then from each patient, and we in the lab are making sure that the veneer is then individually produced for this patient, according then to all the needs and all the details what we are discussing before. What kind of shape, what kind of smile design, what kind of look the patient is looking for, and all these informations we are then in a team together discussing and looking then that we are giving the best solution at the end.
So Joshua, let's speak a little bit about the procedure of veneers, because most patients, they don't know maybe how it goes.
Yeah.
So mainly it's composed from 2 to 3 sessions. The first, also there is like one session like consultation about what the patient needs. They will come asking us like what's exactly they feel they need in their smile, why they want to change it, what's the purpose of it. And it's like a consultation, a checkup, maybe some x-rays, and from there we can speak, if we agree about doing the veneers, we can speak a little bit about the procedure. The first session will be also preparing the teeth for those veneers. So as you said a while ago, it's a ceramic shell, right?
Exactly.
So it has like a thickness.
Exactly.
So this thickness is from?
So when we want to do an aesthetic veneer, we need minimum thickness of 0.3 to 0.5 millimeters to create really a good look.
Yes.
And this is this space what we need then to place.
So that the veneers will not look bulky.
Exactly.
So on the teeth, as dentists, we have to give the lab this space. Otherwise, the veneers will not fit on the teeth. And second thing, they will not compensate for this space. They will look so bulky if we don't give it a minimally a preparation on the teeth. So we are giving the lab this space, but again, don't think that the dentist is going to shave down your teeth or remove a huge layer from the teeth. We are sometimes going for non-prep or minimally prep procedure. So in this case, the doctor will have to polish, if I can say. This is how I like to say it. Just a little bit of polishing of the teeth in the areas where we feel that we need to remove from them. And then the doctor, of course, will take like impression or size of the teeth to transfer this smile to our lab.
Exactly.
And in this session, we can choose also the color with the patient, and if there is any preferable shape that they like about the veneers, we can also do it.
We could also, for example, do a wax up before, so that the patient is getting an idea about the shape, what the
Let's
patient...
explain for them about the wax up, because I get asked a lot
Yeah.
about what is the wax up and what's the use of it.
So, for example, in the first session, when the patient is not sure if the patient wants to go for the veneers or not, we can take some impressions, and we are receiving these impressions in the lab. And according to this impression, we are creating a smile design.
Yes.
And with this smile design, Dr. Rasha can transfer this without even prepping the teeth before, to transfer it on the patient's smile. And then immediately after 5 minutes, you will get the look, and you can see what is possible, what is doable. And according to this, we can still adjust then things, or we can maybe...
How the veneers might look like it's a close idea for the patient, like how might the veneer look like, so that they are not worried a lot about the final shape of the veneers. Exactly. So this is the first session of the veneers. We're done. We can place temporary also between the session, or sometimes not, it depends, but it's always regarding how much we are preparing from the teeth. And then after 5, I think, or 6 days.
Exactly, 5 to 6 days we need.
Yes, the lab will give us the veneers, and before cementing the veneers for the patient as final, we can try them first. And let the patient see. We are fitting the units to make sure that they are correctly placed on the teeth. And then the patient can check the color and the shape. If there is any adjustment at this stage,
we can still do it.
We can still do it before the final cementation. So don't worry, we will not cement them behind your back.
This is true. No, you can still adjust it then.
Exactly.
To make some modifications.
Exactly, some modifications. I have one question for you, Joshua, is about a patient asking about the Emix, why it's called Emix, what's the advance of this veneers over other veneers, and is there anything called 3D or 6D veneers? This is something we need to clarify for the patient.
Okay, so when we are speaking about an Emix veneer, it's glass ceramic. I mean, we have there the opportunity to go for different kind of options. We in the lab, we mostly do it like this, that we are pressing an Emix veneer, and then we are making, we call it kind of a cutback. So we are reducing then the core of the veneer and then layering ceramic over this core to give a bit more.
So layering help us to get what?
Layering means that we are building up the ceramic in different colors. So we don't have any plain...
to make it look more natural.
To make it look more natural, exactly.
And close to the original anatomy of the teeth.
Yeah.
Because before the ceramic was what? I mean, the older veneer, that's not Emix.
This is, let's say, only one layer.
One layer,
of
course, yeah.
When you are pressing this core, this Emix, you have then one layer of the material, and it looks much, much nicer if you are reducing this, especially on the incisal edge, on the incisal area a bit, and you are layering then with different colors, a more natural look on it.
So Emix could mean also a plain surface, or it's mainly like layers?
It can be, yeah.
It can be,
yeah.
As long as it's having some aesthetic features in it.
Yeah.
So if the patient is asking for features in the veneers or anatomy, this is something we can do as additional, right?
This is something that we can do, exactly.
Where we can do, but mainly when we say Emix, it means that it's highly aesthetic.
Yeah, it is.
Regardless how it looks, if it's looking, if it's layering technique or it's having some features in it, right?
Yeah, it's true. I mean, this material we are using already a lot of years. It comes from Germany. Evocla presented this many years back, and
you see, it's Evocla. It's a German company. Remember?
Yeah, this is true. and it's a very nice product. Yeah.
Yes. Do we have like something called 3D or 6D or 7D? I mean, if we're talking about dental terms,
Yeah.
is there something called like this?
Not really, to be honest. I mean, in general, an Emix veneer is an Emix veneer. It just depends then how the technician is finalizing it and
Yes.
how much work he is investing.
But the word is Emax, right?
Yeah,
not
exactly.
3D, not 4D.
No,
Remember this. Just follow the word Emax veneers.
Yeah.
And again, like Joshua said, Emax could mean a plain surface or a layering technique, but both of them will give you aesthetic look and aesthetic features of the veneers. Now, some patients will ask for extra features like a transparency, for example, translucency on incisal edge, or maybe some anatomy or structure on the surface, or layers like colors or stains, right?
So this is then what we are, what we can speak about. For example, when in this stage, when the patient is coming and deciding to go for the veneers, we can give some samples. We can show some cases what we did, so the patient is more understanding it and get an idea what kind of different options we can give.
You can always choose what you want for the veneers while communicating with the dentist or the ceramist, and they can also visit the lab, right? In case they want to check something directly. If you have any questions, please give us questions so we can answer them. I have also a question for you, Joshua, regarding sometime the difference in the prices of the veneers. You just need to tell the patients exactly why there's sometimes difference in the prices, if it's possible to clarify.
Yeah, of course. What we had already, I mean, this plain surface veneer and then the veneer where is more layering technique involved. This is then depends how many hours a technician is spending to produce these kind of veneers.
How many hours they can spend?
You can spend for this days. It always depends, let's say, how big the case is, how many units we are producing. If it's, let's say, 10 veneers in the upper jaw, a technician actually is spending 2-3 days.
Lots of time.
Of course.
Doing it, like 2 to 3 days.
Yeah.
So
I mean, like technicians, they are kind of artists. Yeah, they want to play with this. They want to put all the details.
So patients think that the case of the veneers should be done in 1 day. That's not correct.
No, this is not possible.
That's not possible. Please, you need to also think about the lab, that they are spending some time working on these things, and in order for you to get a good result, you need to be patient with the lab and the dentist and give them some time to work on this case. If you want it to be really perfect, like don't rush the doctor or the lab, because they have also other cases and they need to take their time.
We are definitely we are not taking the veneers out of the drawer and they are done then. Yeah, so
it's not like ready and we can fix them immediately.
There's a lot of handcraft involved. Yeah,
a lot, and you will not believe how much they spend time in the lab doing these veneers. I mean, for the dentist, the work mainly is in the clinic around like 2 hours each session, and that's it. But for the lab, they are spending lots of time working on these veneers. As Joshua said, especially if it's a layering thing, like it really needs lots of concentration and lots of work if you want it to be done perfectly. So
and at the end also I mean, of course, we are speaking about the aesthetics and the look, but the most important thing is also that the veneers are fitting. Yeah, that they are fitting like a glove on the tooth, so that we don't have any gaps or any short margins or things like this.
Yes, I agree. You need to be careful as patients how to choose the clinics who are doing the veneers, because the veneer is not like it's so preferable recently more than the composite veneers or the whitening. I think it's good for the patients to know why they would be encouraged to do veneers.
I mean,
right?
like Emix veneers, it's a pure ceramic, and that's why the surface it's totally different to composite veneer.
So they last longer.
They last longer. They are not changing their colors after a while. If you're drinking,
discoloration, no stains on them.
Exactly. If you're drinking coffee, tea, and these kind of things with this composite veneers, you have sometimes after a while different colors or
some
color
stains.
change or something. All these things you don't have with Emix veneers. Yeah, that's why they are way more aesthetic
and durable.
Yeah.
But there's different again. There's different shades of white. I mean, recently most of the patients are asking me, we don't want the super white, the super bleach.
Yeah.
So also this is something for the patients to know how many shades we have.
We can go from super white to super dark. Yeah, I mean there are all kind of different colors.
No, I'll go for super dark.
We have
different shades, but
exactly
starting
like the brightest one is BL1 bleach color. So we have 4 different types of bleach colors. Is BL1, BL2, 3, and 4, and then let's say after these bleach colors are the let's say more natural colors coming. This is then B1, which is then there the brightest. Then we have A1, A2, A3.
And you can always check in the clinic with a shade guide with the dentist which color suits you. Like you can take the shade and try it and check on the mirror.
Exactly.
If everything is perfect for you and you see that this color is convenient.
And with this wax up, for example, you can use also different materials. You can use a bleach material to try it, or you can use maybe a B1 to have it a bit more natural. Always depends what the patient prefers.
Yes, exactly. And that's it. So do you want to add anything, Joshua, about the veneers? Do you have any advice for our patients?
I mean, what I would say is definitely when someone is interested in doing veneers, you should come to the clinic. You can see some cases here also. You can see how the procedure is done. You can visit us in the lab if you want. You can see how the technician is working on these kind of veneers. And definitely point to be convinced is this type of wax up, and to see how can I change my smile in adding some volume of my teeth. And there is definitely a wax up the best solution to see what kind of result I can get without even touching and drilling and not changing anything.
Yes, and remember, if the veneers are done correctly and perfectly, and if the fitting of the veneers, should be done well by the lab, the veneers, they don't have really any side effects. I get lots of questions regarding any smell or cavities under the veneers or any issue with the gum. But if it's done perfectly and the veneers are fitting well and it's done from a good quality, you will not have any issue with it. You just need to keep brushing and flossing normally as you do. And if you have any question, you can just ask the dentist if you have any more details or inquiries